In the United States, daily cases are increasing after an extended decline.
We are now having 40+ thousand new cases a day.
We're seeing significant increases in the southeast and southwest regions of this nation.
I would not be surprised if we go up to 100,000 a day if this does not turn around.
The U.S. accounts for a quarter of the world's COVID-19 cases, and hospitalizations and deaths, which usually lag a couple of weeks behind new cases, are up now too.
Hospitalizations now are going up in 12 states, and as of this weekend, daily death now has increased in the state of Arizona.
So how did the U.S.'s pandemic fight go so badly, and where did the U.S. go wrong? Newsy spoke to health experts who say years of underfunding, ineffective testing, and general confusion and politicization all led to the crisis the U.S. now faces. Disease prevention and public health funds haven't kept up for years, which trickles down to state and local health departments who rely on public health emergency preparedness grants from the CDC. The grant program has seen funding cuts since 2003, with no change the past 2 years.
Domestic and global health security funding needs for public health really have not kept pace with growing needs. So on the global health security side, some experts have recommended that an additional $100 to $150 million is really needed over current funding.
The core capabilities of our public health infrastructure is not there. The CDC is right now probably providing 50 to 70% of all public health funding to each state. We need to have a much more robust investment in these core capabilities.
In a Senate meeting this week, CDC Director Redfield said $12 billion of CDC money has gone to states, essentially catching up from years of public health underfunding. He promised community-based COVID surveillance to local jurisdictions by mid-July. Then there's testing, which in the crucial early stages of the pandemic was ineffective, contaminated, or unavailable. Even today, doctors Newsy has spoken with are calling for more testing.
That is a thing that has to be more available. I think that the more that becomes available, the more we can open up our economy, the more people can return to their jobs.
Reopenings have also troubled health officials. Health experts say more of a dialing up or dialing down model should be followed as cases rise. Instead, they say too many places have jumped ahead prematurely.
We've got to make sure that when states start to try and open again, they need to follow the guidelines that have been very carefully laid out with regard to checkpoints. What we've seen in several states are different iterations of that, perhaps maybe in some going too quickly and skipping over some of the checkpoints.
And then there's the disbelief towards trusting doctors and scientists. Outrage and politicization about masks, for example, have played a role in doubting or selectively searching for studies whose findings don't match CDC guidelines.
A lot of people will be Googling and looking for primary scientific papers, and inadvertently you start putting in your own bias, meaning that you start cherry picking the papers that satisfy the answer you were already looking for. And that's dangerous because then you're not looking at the whole picture. When you talk to experts in the field, we have spent decades reviewing those kind of articles, and we can see which ones make sense and which ones fit and which ones don't. When you only look at 2 or 3 out of the 30,000 studies that may have been done about hand washing or face masks or infectious disease or droplet precautions, it's very hard to understand what is the takeaway there.
Lindsay Thies, Newsy, Denver.